Mental health struggles don't happen in a vacuum. They often affect entire families. If you've ever supported a loved one going through a tough time, you know how overwhelming it can be. We sat down with psychiatrist Lilianna Yuen to talk about what that experience can look like, how roles shift within families, and why breaking the stigma around mental health matters. Dr. Yuen, thank you so much for being with us today and talking to us about this topic. How exactly can somebody who might be experiencing a mental crisis, how does that impact family? How have you seen it in patients and their families?
Yeah, of course. Thank you for having me. This is a really important topic, so very excited to talk about it with you. So especially early on, when people don't know what to do, sometimes the person is refusing help. It can be really, really challenging. People sometimes don't know where to turn. I think that in a kind of a more positive light though, if people do get appropriate treatment, it can lead to better understanding and healthier relationships within families as well.
What kind of dynamics can tend to shift if somebody were to take on the caretaker role?
It depends, is it a parent or a child or another family member who's taking on the role? It can be challenging because people may have a change in dynamics of the family, right? If someone's coming in as a caretaker when they didn't used to be, or the other person maybe even used to be their caretaker. Sometimes the patient or the person with the mental health issue will have to kind of accept that shift in dynamic, and they can lead to like feeling loss of control, maybe even anger at that person.
And let's talk a little bit about certain stigma surrounding even just the conversation of mental health. How does that also impact not only family members, but the person experiencing a mental health crisis?
Yeah, of course. I mean, stigma is huge. Don't be afraid to talk to people about it. It's actually a lot more common than you realize, and sometimes you might even find that other people are going through something similar. So, and I think even just by talking about it openly, that's one way that we can reduce the stigma.
Other emotions, do you see burnout? What are other experiences that family members start to feel once they do step into
that role? Yeah, of course. There's a lot of emotions that maybe seem like they shouldn't be talked about. You mentioned burnout. People can have what we call like compassion fatigue, where you just get really tired of having to keep that empathy and that compassion. There's also something called vicarious trauma. So just seeing your loved one go through these traumatic experiences and kind of having those feelings too, that's a big thing that happens. I think it's important to recognize that these are just normal emotions and that we all experience them, and you don't have to feel bad about having them if you are in that role.
How can somebody who finds themselves so overwhelmed with supporting that family member that is experiencing something difficult, how can they not lose themselves along the process?
Yeah, that's a great question, and it's so important too. I think just taking time for yourself. If you are in therapy or you have your own individual therapist, making sure that you have a place to talk about what you're going through. And then just self-care, being able to step away, do the things that you need to do.
Is there anything that I might have not asked that you think is important for people to know about the topic, and especially for family members who might be resonating with this?
I think just the whole conversation of mental health being a family affair and not an individual one. And so I think that family therapy can be hugely important. It's something that unfortunately I don't think enough people have access to, but it can be a good thing because everyone can benefit from it, and it might even be an entry into mental health care for other members of the family.
Definitely. No, it's so important. I'm glad you brought that up. So thank you so much, Dr. Yuen, for your time. We really appreciate it, and for talking about something really, really critical. We appreciate it. For more information on mental health care for you or a family member, please visit communitymedical.org/mental-health.